Nearly 1 in 10 Americans have diabetes, and about 1/3 of the adult population have prediabetes. So what does that mean for us? Today we're going to learn a little bit about what that means and how we can make a difference. I'm here with Kari Erickson from the Nebraska Urban Indian Medical Center, and I am with Kaser, Great Plains Quality Innovation Network. All right, well, thank you guys for coming out.
Thanks for having us. Glad to
All
be here.
right, so let's start out. Can you give me sort of what is diabetes and prediabetes? What do we need to know?
Diabetes can be confusing in a sense because there are many types of diabetes. There's type 1 diabetes where the body just doesn't make enough insulin. It can develop at any age, and it accounts for approximately 5% of the population. Type 2 diabetes, on the other hand, is where your body just doesn't use your insulin effectively, and it accounts for 95% of the population's diagnosis of diabetes. And prediabetes is defined as blood sugars being higher than normal, but not yet high enough to be considered or diagnosed as type 2 diabetes. But the good news is there's ways to prevent prediabetes and type 2 diabetes. So.
Right. We know there are a lot of risk factors for developing type 2 diabetes, and some of those are obesity or being overweight, and others are inactivity or a sedentary lifestyle. So if you know your risk factors for diabetes, you can help prevent the diagnosis by doing some interventions soon to help reduce those risk factors. Now, when we talk about risk factors, it's for type 2 diabetes and prediabetes. Type 1 diabetes is not with the risk factors of obesity and sedentary lifestyle and heredity. Type 1 diabetes is an autoimmune disease. We never know when it's going to strike, and there are no risk factors for it. But Kari and I, both of our organizations, are trying to help with diabetes self-management education, offering group classes free. And with my organization, Great Plains Quality Innovation Network, we use a curriculum called DEEP, which stands for Diabetes Empowerment Education Program. And those classes are offered throughout Lincoln at different sites. They are free. They are 6 weeks in length, and classes meet once a week for about an hour and a half. And that curriculum is built on a lot of interactive activities and adult principles, so the classes are for those age 18 and up.
Dee, can you tell us a little bit about your organization, so for the people who may not know?
Sure. So Great Plains Quality Innovation Network is a quality improvement organization that's funded by the Centers for Medicare and Medicaid. We are part of a 4-state group. The Dakotas, Kansas, and ourselves make up the Great Plains Quality Innovation Network. So I represent, of course, Nebraska, and one of the initiatives that I'm working on is called Everyone with Diabetes Counts, and that initiative, the tasks that are involved in that are to offer diabetes self-management education to Medicare beneficiaries, low-income minority groups, any disparate type population that wouldn't otherwise be able to receive quality diabetes self-management education and support.
Perfect. All right, Kari, can you tell us about your organization as well?
I work with Nebraska Urban Indian Medical Center, and we are a family practice clinic, and we serve all ages from birth to elderly and all race ethnicities. And we offer group education classes to the community, and we send out flyers and try to advertise those every month on different diabetes topics such as healthy eating, exercising, monitoring your blood sugars, taking your medication, the importance of taking care of yourself to prevent complications from diabetes. And we also offer one-on-one individual education for our established patients. And so they can see myself, the diabetes educator, as many as 1 to 10 times a week if need be, just as much as the patient needs, and it's individualized. So we're there to offer free education both in the group and individual settings.
And you mentioned again, these are free and open to all public, correct?
Right, yes. The group education classes are open to the public, and we invite all of our cultural centers around the community and try to spread the word to get more people, because we know how important education is to manage diabetes and to prevent it.
All right, so both of you are part of Action Now as well. Can you tell us a little about that collaboration?
Yes. Action Now is a committee that Dee and I are both on, as well as other community members and organizations in Lincoln, to work together to try to spread diabetes awareness to the community and spread the word of resources that we offer throughout Lincoln to help patients that are newly diagnosed with diabetes or that have lived with it for years.
We have a lot of members from the community. Anybody that actively involved with diabetes education, diabetes educators, they all are welcome at the table. So we hope to be more active in the community, be a more bigger resource for providers and for people who are living with diabetes as far as where can they get education, what are reputable websites, and different things of that sort.
So for our viewers, what's the next step for them? Where should they be talking to people? Where should they get more information? What would you suggest?
I would suggest, first and foremost, we're trying to get the word out to local healthcare providers. So if they would start there and find out if there are resources within their facilities where they go, the local hospitals are part of our Action Now and can give resources, along with many websites that we'll list at the end of today to let people know what we are offering, so, and what's out there.
Right. And I know you'll list my organization's website, but we do have partners all across the state that are offering what we call the DEEP curriculum, which stands for Diabetes Empowerment Education Program. And those workshops are free, and in some communities they're offered in Spanish also.
There are probably a lot of people out there that are saying, oh, this doesn't affect me. I don't have diabetes. Why would I have diabetes? There are a lot of people that don't know they have diabetes, correct?
Yes, so it's important to, every time you go to your doctor or just make an appointment to go to get screened for prediabetes or diabetes, because a lot of people do have it and don't know they have it because there are no symptoms until they get really sick. So we're trying to get the awareness out there so people can get their health taken care of before it's...
Right. The American Diabetes Association's website offers a risk test that people can take to see if they're at risk for type 2 diabetes. And I would encourage anybody that wonders, is this something that maybe I could be looking at as a diagnosis later in life or now or whenever, to take that risk test and see if they score high on it. Type 2 diabetes has a huge genetic link. So if you have parents, siblings, or even your own children that have type 2 diabetes, that in itself puts you at a higher risk. Anybody over the age of 45 puts you at a higher risk. So there's a lot of things that people don't think about as a risk factor for themselves. So I would definitely promote that risk test.
Well, thank you both for all the work you're doing, and we'll try to get the word out and make a difference.
Absolutely,
Thank
thank
you.
you.
Yeah.